Alright guys, so in this video what I'm going to do is talk a little bit about resources for psychiatry rotations, resources for intern year in psychiatry. So a lot of times people are going to ask, especially the new interns, they come in and they say, well, what are the resources? What is the best book? What is the most important thing for me to buy? And my feeling on it is you have very limited amount of time when you're in residency, so you can't choose a lot of different resources. You kind of got to pick one resource and work with that resource, and that's it for each thing. So I'm going to go through my top picks, and I have a few here, and I'll share them with you right now. So the first one I want to start with is the psychiatric interview. So this is an excellent little resource for anyone that's starting their psychiatry residency. What makes this book so valuable, in my opinion, is that it gives you a lot of different options and lines of questioning that you can use when you're interviewing a patient. So one of the most difficult things at the beginning is, what questions should I ask? What screening questions should I ask? How should I phrase those questions? What's the best way to elicit suicidal thoughts? What's the best way to screen for depression? What's the best way to screen for bipolar disorder? And what this book really does is it breaks it all down chapter by chapter. Covers mood disorders, covers psychotic patients, covers agitated patients, covers just about any clinical scenario you might find yourself in as an intern. So that is extremely valuable. And this will help you to develop your own line of questioning when that time comes. So I highly recommend this book. It's a short read. It's very easy. It's not going to take you more than a day or two to go through the whole thing. And the value you're going to get from this in your interviewing skills and your ability to elicit the information from the patients is second to none. So highly recommend it. I would say go out and get this first day. Learn about this stuff immediately because it really does go a long way for the rest of the year. The next thing I'll talk about is psychopharmacology, because everybody needs to know, a little bit about the psychopharm stuff, and you're going to want to be an expert in that area because that's what sets you apart. So everybody knows Stephen Stahl is the man when it comes to psychopharmacology. His texts are kind of the classic texts and the go-to texts. This one that I have here is the textbook version of his essential pharmacology. It's not too detailed, it's not too difficult of a read, and it really does break down all of the medications, all of the mechanisms of action that you might see, and gives you the things that you're going to want to know when you're explaining things to your patients. Okay, so that would be my recommendation as far as for books for pharmacology. Now, for your regular reading, for your everyday kind of reading situation, chapter by chapter, board prep type of thing, I'm not a huge fan of Kaplan and Sadek's books. Everybody loves Kaplan and Sadek. They say that's the gold standard. A lot of residency programs give that book out as their standard textbook for reference and for learning. But in my experience, it's poorly organized, it has a lot of fluff in it, and it's really just not a great read. I personally had no success with it. I did not like it. So I had to find an alternative choice. And what I found to be my favorite is the Mass General Comprehensive Guide to General Psychiatry. So the Comprehensive Clinical Psychiatry book, very, very good. It's a little thick. It's big. It's got a lot of chapters. I wouldn't say in residency you're going to make more than one really awesome pass on this, one really good pass on this book. But if you do, you're going to be a lot better off because of it. You're going to know a lot more about psychiatry, and your depth of knowledge is going to really shine through on your clinical rotations and in didactics and on PRITE exams and board exams. This book breaks down pretty much everything you ever wanted to know about psychiatry into kind of small, fairly easily digestible chapters, and it's well written. It's concise, or as concise as a textbook can be, and it really provides excellent information that you're going to want to know for any rotation and for any disorder that you could think of in psychiatry. The other one I forgot to pull out here from my bookshelf, but I do think it's also an excellent choice, and anyone who's on inpatient psychiatry or consultation and needs a desk reference, again, it's Stahl's Prescriber's Guide. This can be had on Amazon for about 50 or 60 bucks, something like that. But the reality is I go to this book every single day and I read about the medications that I'm prescribing. I'm able to go through the dosages. I'm able to go through starting doses, loading doses for injectable medications. Any kind of, there's a whole clinical pearls section in here that's incredibly valuable as well. And that tells you a lot about, special uses for the medications, ways in which it might be valuable to your patients. It also tells you again about starting doses, how to titrate, how to taper the patient off, what to do with pregnancy and pregnant patients. It just is a wealth of knowledge, again, concise, easy to read, easily digestible little sections on each drug, and it really covers pretty much every drug that you as a psychiatrist might be using in your arsenal. So that would be my other choice, and those are probably the 4 books that I would recommend you get at the beginning and start using right away. Beyond that, there's other texts out there, and I can do a separate video where I talk a little bit about question banks and other things that might help you. But as far as your book knowledge, your reading, that's a really awesome place to start. So highly recommend it. And if you guys are going through the grind right now, I wish everybody a great deal of luck out there, and good luck on your rotations, good luck in your career.